being productive myself in my many years of practice and not stagnating. I want to continue to kind of grow. And one of the ways that I wanted to grow was to add to my practice as an OT some of the things that I may need later in life. And one of the things that I have been finding was the fact that as we age, we have a lot of ideas and goals about what we wanted to do when we were younger, and suddenly the goals are a little closer to us, and some of us don't come to the realization of maybe meeting those goals. When I was asked about doing a presentation, I realized I may be preaching to the choir here today, but I want to get you all involved in what we're going to do and keep you awake for 45 minutes. So we're going to kind of combine those two things. I'm the director of rehabilitation therapy at University Hospital and have been about 8 months. Prior to that, I spent a lot of time in psychiatry, psychiatric services, and rehab, and worked primarily with the geriatric population. I did a geri-ed program. We worked a lot on mental issues, but we worked more so on the loss of physical function. So that's kind of my background and where I want to take y'all today. Now what I'm going to ask you to do is to be careful and step out of your chairs just for a second. Now, I don't want you to knock over your notebooks or anything. Like that. Okay? All right. Now what I'd like you to do is sit down. Good. Now stand back up. Good. Now what I would like you to do is to sit halfway down, but don't go all the way. Now just stay there. Okay. Now lower yourself to your chair. Good. Now take a breath. All right. Was that hard for y'all? No? Anybody with knee problems? Okay. So it may have been hard for you. Problems with the hips? No? Okay. That type of exercise is something that we take for granted, right? Y'all pop up out of your chairs and you sit back down, you pop up out of your chairs. But as, of course, you know with the population that you see, it gets harder and harder to be able to pop up out of the chair. In fact, most of you, as I was watching you get up, do it the regular way where you just don't think about your body and you move forward. As we age, we tend to do certain movements in a different pattern to get up and to sit back down. And when we're reteaching, if somebody's been sitting in a wheelchair or seated for a long period of time, they do it poorly. And what they try to do is to go straight from standing to sitting without doing any sitting towards the edge of the chair or cheek walking or any of those kind of things. And so what they do is they jeopardize or put themselves in a stress position instead of being able to be in a more functional position. Now, as you were doing that activity, and I was asking you to hold, what was in your minds when I was saying hold? How long am I going to stand like this, okay? What else was going through your minds? Okay, the discomfort that might come with it. How long do you think you actually held yourself in that position?
15 seconds.
It was about 10 seconds, right? Okay. And then when I said sit down, did y'all really want to stand back up? Yes. Most y'all, I saw that y'all wanted to go up with it instead of going on down. Okay. There's a series of exercises that PTs tend to, and OTs may do this as well, to train people how to sit back down and to stand up and to do transfers and to those kind of things. But a lot of times what happens is we age, we've already been compensating for our inability to move in a certain position, or we like sitting better than we like standing. And according to, let's see, a recent study that was done by the AMA about, well, over a lifespan, if you sit more than you stand, you lose about 25% of the length of life that you might have. Because what they want you to do is to do more vigorous activity, to move. And since this topic is talking about mobility, we need to also attach to that your endurance and your flexibility. I'm going to ask y'all to do another little thing. I think you can do this while you're seated in your chairs. Okay? What I want you to do is just to go like this and just touch your fingertips together. Okay, and I see some of us can do it, okay, right? Okay, maybe limited by our sleeves. Now, relax. Yeah, your garments or your things. Okay, now, were you able to touch your fingertips? Yes. Okay, now, I want you to do the opposite direction, okay? No? No? Okay. What did you discover?
Obviously, I automatically did it the way that was easiest for me because the second time
Wasn't as
I
easy.
could barely touch.
Right. Okay, so most of the time you're going to go over with the more dominant side too. You're going to go with your right side if you're right, and vice versa. When I asked you to change, did you actually have to think about where your body needed to go? Well, what was the difference with that? It was awkward, didn't feel right. So most of the time we go for the least resistance. We're going to go in the direction of least resistance, and that happens to most of your clients, or yourselves, depends. And when I asked you to do that particular activity, did you notice yourself contorting in order to do it? Well, it's not a natural movement. We most of the time don't think about doing this. But if you're an occupational therapist and you're training someone to hook a brassiere or to zip up a dress or to hook themselves, they're actually using a lot of those motions. Men don't normally get into those positions, but women do. And since a high percentage of our patients get osteoporosis and other things that are damaging to their joints, they will tend to stop doing that because of the pain factor. And I think y'all heard about pain this morning. Okay, are y'all awake? No. Yeah. What do y'all think of my picture? Are you able to see it? Yeah, love to go there, right? When I was trying to think of something to put up here just to get y'all's attention, I was thinking about this is most of the time when we think of geriatrics and gerontology, it's past the fall of our life and it's more into the winter. But to me, the winter doesn't look so bad. I think it's absolutely gorgeous, and I look forward to my winter. Okay. There was an article that just came out recently, and some of you may have seen it. This was, I just copied this right off the top. It's called Stopping the Clock. Whoop, what did I do to it? A report from the anti-aging frontier. And it was mostly talking about the fact that no matter what the age, as long as somebody starts moving and doing some weight resistance, that they can improve their ability to function. In fact, they can improve their muscle by 10 to 20%, but it can increase their strength by 100 to 200%. And that's for geriatric ages 80 to 90. Okay, so we're not talking what you might 65 and over. We're actually talking at the old age range. This article was very good. It was written by one of the professors, actually two of the professors here, Dr. Masoro. I think I'm saying that right. Does anyone know Dr. Masoro? Mesro. Thank you. I've not said it out loud, so I just read it. And he went more into the metabolic aspects of aging. And then it was also in part written by Dr. Diane Torney. So you can tell I don't say names out loud. But basically, it's talking about the fact that we want to begin to stop the clock. And no matter what your age, you're not too old to reverse some of the processes, including those things that affect us with osteoporosis, especially with females. So if you get a chance to read this article, it's really very good. And it was written by Madeline Drexler, the author of it. But what do y'all think of the picture of the body? Can you see kind of the outline with the muscles?
That's
Okay.
muscle.
Do you know how old the person might be that could be in this drawing?
75.
Could be any age, right? Right? There's a gentleman who's 88 who the article starts talking about who has begun to do the weightlifting over the past 5 years, has increased his body to look very similar to this. So it doesn't matter your age. The muscles are still there as long as we retrain them. So stopping the clock, that was a really good article. Everybody breathing right now? Yeah. Did you know when you do exercises, the majority of people have a tendency to stop breathing? I don't know why they do that, but they hold their breaths. Okay? And so you have to constantly be reminding them that they need to be breathing. One of the things you also find is if you get preoccupied in doing something, you might find yourself not breathing. Even if you're just doing a normal mundane task, you'll find that you go, whoa, you hadn't been breathing for a very long period of time. Just for a second, I'd like you to concentrate on your breathing. I want you to close your mouth. I want you to breathe just through your nose. How deeply did you feel the air go down? He says pretty deeply. Pretty deeply, okay. Most of us are chest breathers, so we're going to have a tendency to feel it here. Now I want you to concentrate on a deep breath, and I want you to bring it all the way down in. I want you to breathe in Bring it in, and then let it out. What was the difference? Do it again. Bring it in. And let it out. What was the difference in the breathing before and after? Say, took a little more effort, right? More thought. You brought in more air. You actually probably felt some expansion of places that hadn't expanded. Muscles felt better? Okay. Yeah. You had to bring it up and back. I saw some of y'all really stretching to get it in. That's one of the things that is primary to doing any type of movement, any type of, yeah. Were you going to say something?
No, I'm still breathing.
Okay. Well, I'm going to have y'all do another stand-up exercise. Okay. Now, for those of you who have knee problems, this may be a little bit of a problem for you. But if you don't have a knee problem, just go ahead and flex just a little bit. Flex your hips and your knees and just relax. Roll the shoulders over. Okay? Now, what I want you to do is, as you stand upright, you're going to bring in as much air as you possibly can. So you're going to be bringing the air in as you're standing up. Ready? Breathe in. Now bring in some more. And blow it out. Do you feel that? Okay, we're going to do it one more time. Bend the knees a little bit. Roll over, not too far. Again, breathe in. Straighten up. One more breath in. And let it out. Good. Now, what did that feel like? Different? Better? Okay. Pardon?
So it's hard to get that last breath.
That last air in. That's a vital capacity that we got in there. We have that availability to us all the time, but we forget it. Okay. Feel all right? Feel like you want to sit down? Like standing? No? Have a seat. Two things that we try to combine when we're educating patients or we're educating staff is we want to teach them to do the movements correctly. We want to teach them to do the exercise correctly. We want to tell them to walk a certain distance. We want to tell them to do the particular activity well. But one of the things that we want to make sure is that they have enough reserve energy that they'll be able to perform the activity we're requesting. And one of the tasks that we just did was to learning what your capacity is. And right now you'll notice you may feel just a little bit better. You might be more awake than you were just a second ago, just because you brought in a little extra reserve of the oxygen. Some of you may be coughing or experiencing a little discomfort if you've been a shallow breather for a while and we've expanded the lungs a little bit. We would want to continue that type of exercise for yourself 3 to 5 times a day, and then pretty soon maybe it would become a habit for you and for anyone else that you're teaching. I have a slogan for you, and see if you've heard it. The secret to a long life is surprisingly simple. You're as old as you let yourself be. Yeah? How many people do you know that let themselves be older by choice? A lot of people. And how old might those people be if you just give me an age?
60s.
60s? How about 40s? How about 35? Okay? There are a lot of people much younger who choose to be older, okay, because of inactivity, a lack of mobility, a lack of desire, a lack of motivation. And there are a couple reasons why many of us do exercise. Why do y'all do exercise? Feels better. Energy level picks you right up. In fact, y'all might feel a little more energy just doing the breathing, standing. What else? Why else do y'all exercise? Okay, yes. I go for a walk every day with my dog. It's the way I get out of my stress. What else? Toning, keeping nice. What else?
Flexibility.
Okay.
Health. How it decreases glucose levels.
Okay. Is that from this morning?
That's what I do.
Okay. Decreases the glucose levels?
Yeah, with activity.
Okay.
Weight control.
Helps you with the weight control. What motivates you all, though, to do exercises or activity? What helps you do things for yourself?
Self-esteem.
Self-esteem? Doctor tells you to? Okay. And what happens, though, when you've had a bummer day? When, it just didn't go well at work or it didn't go well for you and it's cloudy and you decide you're not going to do what you normally do, what happens to you physically? Feel worse? Don't you make yourself more tired that way too and just feel real draggy? Okay, what happens if you combine those days and string them out in 10 days? Say, for instance, we had a cold front move through and you couldn't do anything. What happens over the 10-day period for you?
Maybe you end up getting sick.
You might get sick, okay? You get depressed. Did I hear depressed? You get depressed.
Lazy.
Yeah, very lazy. And then even though you have the desire or the goal to go and do something, it takes a lot of willpower on your part to actually get back into the scheme of things, to get back into your personal rhythm of activity. And so if you think about people who are housebound or who choose not to do activity no matter what their age, it's no wonder that it takes so much talking to or through or pushing by somebody else to get them to do it. They'll do it, though, for how long if somebody gets them started? Say, for instance, a patient comes in and they say, you know, my knee's been giving me problems, and could you work out a program for me? I'll do it every day, I promise. How long before it's not every day?
About a week to 10 days.
A week or less.
A week or less. In fact, how often do you as therapists or nurses or administrators or whatever, how often do you tell somebody, this is the best possible thing for you? If you just do this, you'll just feel wonderful. Do you think they actually do it at all? About 50% will do it. Those 50%, after 6 months, what do you think, how many do you think would still be doing it?
Quite a few. They may get hooked if they stay on it that long. No?
They say after 6 months that there's a 50% dropout rate. So you figure 50% went home and went, yeah, sure, set it down, didn't do it at all. Then what was remaining, 50%, they did it for 6 months, they stopped. So you get about 25% of the population that will continue to do some form of exercise. And those are just the ones that you talk to. Now, there's an ongoing urge or frequency because they go back to the doctors or they have some other medical problem, and the doctor says if you would only do exercises, you'd feel better. If you would only do exercise program, you'd feel better. But I think what we've missed out on is it doesn't have to be calisthenics, it doesn't have to be calinetics, it doesn't have to be jumping jacks or running. It's just some form of activity or movement. That's all, okay? Even walking. Just walking a short distance. My grandmother just recently passed away, and bless her heart. She used to walk 6 blocks. Now, I don't know how many miles that was for her to walk 6 blocks, but she dedicated herself daily to walking those 6 blocks. If she didn't, she would go to Macreola's Mall, and she would walk in the mall. That was her way, and she died at 93, so I think that's pretty good, of keeping her energy level up, was to do her exercises. And I don't know where the motivation came for her to do that. I don't know what stimulated her to do it, because her 2 sons, my step uncles, don't do any type of exercise, and they're all both under 60. So something stimulated her. Okay. Some of the factors that you want to participate in is the type of activity you've selected, what the intensity is, the frequency, how hard is it for you to do, whether you feel like it's convenient or not, because if you have to go someplace, health spas are rich, okay? They're very rich. And if you consider how many people join a health spa, within the week don't do the exercises anymore, they get to keep all of your money, they're pretty wealthy. You put it in your own pocket, do some things for yourself at home. There's also a factor called enjoyment. If you don't do something you enjoy, are you going to succeed in it? Not at all. In fact, you're going to probably be like me. Are you needle pointing or cross stitching? Counted cross stitch? I have at home a counted cross stitch pillow. That was a delightful gift someone gave me because they knew I like to do handwork. And I go, oh yeah, I love handwork. And I looked at it and went, oh, okay, I'll try to do this. And she says, let me show you how to do it. She could do it with her eyes closed. I couldn't. It took a lot of time. And she would ask me, how's your needlework going? Great. How's your needlework going? Fine. She goes, well, why don't you let me see how much you've done? I brought it back out, turned, she goes, Rosemary, this is what I did when I was over here at your house. And I said, I hate it. I absolutely hate it. And she goes, oh, I'm sorry, I didn't realize that. It was under my bed for months. And I just kept telling, well, anyway, that's what happens. We shove things under, we put things in cabinets, we sit and we watch TV. What do y'all feel like if I use the term moderate activity, that means? Moderate.
Not too strenuous?
Not too strenuous, but 3 times a week. Okay? Maybe once a week even if you play tennis once a week, or you go for a walk briskly, right? That's moderate activity. How many of y'all know people that do no activity? Okay. Now what they're saying is if we want to extend our lives, we have to do vigorous activity. Vigorous activity means not only do we increase the heart rate, but we also use the muscles, we use the body. And that includes 4 hours of vigorous or fast walking, or 12 hours a week of running. Excuse me, I reversed those. 4 hours a week of running, or 12 hours a week of walking. And many people can't fit that into their schedules. But if they heard some other statistics, people could lower their colon cancer rate by 50% if they did vigorous activity. That's mostly for men over age 50. I think if we start applying an outcome for them, maybe they would be more willing to do it. I know for y'all that you're in the healthcare field that you would do that, but we need to stimulate it to a level that other people will take care of their bodies. Okay, I'm going to ask y'all to do another exercise. I love exercises. This is hard. This is a hard one. I want you to think about co-contracting all of the muscles, including the face and neck muscles, the top part of your body, without doing anything to the lower part of your body. Okay, so you can close your eyes if you want to, but I want you to co-contract everything at the top without tightening the bottom. So at your own leisure, ready? Tighten. And relax. Okay. Did y'all feel some tightening down here too? Yeah, it's a little tough to do, wasn't it? Okay, well, we're going to reverse it. You felt like what that was like. Now we're just going to do the bottom only. So relax the top. You're going to tuck in the cheek muscles and everything else. Tighten those toes. Ready? Tighten. And relax. Okay? All y'all held your breath, didn't you? I knew it. Okay. I could watch your face. Now, that was work to do both of those. Didn't go anyplace, did you? No, you stayed right in your chairs and you did it. And I knew some of y'all were doing the right technique because you heightened on the chair a little bit. Tightness. Okay. Now what I'm going to ask you to do is to isolate. I want you to do just the center part of you, but I'm going to ask you to do a chore. You must breathe while you're pulling in your abdominal muscles. Okay? Some of you will be able to do this. Others will go, I can't do it. Okay, ready? So we're going to bring in the abdominals without tightening the rest of your body. Leave it loose. And breathe. Okay? Ready? Go. Breathe. Keep tightening. Loosen the rest of you. Keep tightening. Breathe. And relax. How many of you were successful? Okay. What did you notice, though, as I said to relax? What parts actually began to relax? Chest muscles, shoulder muscles. See, we called those in even though we were actually concentrating on the abdominals. And I'm not a physiologist, but I do know that we can isolate particular muscles in our bodies and we can feel them tighten, we can feel them tense. And there's, of course, isokinetic and isometric and all the other isos that we're going to discuss. But that didn't require you to go anywhere. It did require you to do what? You had to concentrate. You had to use some of the cognitive processes. What else did you have to do? You were breathing. You were also beginning to identify that your body does break up into various parts. See, most of the time we see the body as a whole unit, and we forget that we have that capability. There are a couple schools of thought on aging, and you may have heard a couple of them this morning. One of them is that it's genetic, that you have a pre-programmed time frame, and eventually your body's just going to fall apart. Right? You're going to get cancer, you're going to get it. You're going to get heart disease, you're going to get it. If you're going to have problems with osteoporosis, hey, it was in your family, you're going to get it. Okay? That's a theory. There's the other theory that goes a little bit differently, that essentially you wear out on the cellular level. Is that true? Okay. What happens to our cells if they wear out? Okay. Does it change our metabolism? Slows the metabolism down. What happens to our eating or our dietary as we get older? Does your appetite increase or decrease as you get older? Decreases. In fact, so many older populace don't eat. Is that right? They eat one meal a day and they say that's enough for themselves. What happens to the energy level for yourself if you eat just one meal? Not good. Some of us do it. Okay, some of us do it. What else happens if you miss a meal? You yourself miss a meal. What happens to you? Don't you get a little agitated? It's like you can feel yourself, I missed my meal, I've got to eat. Okay, and you get real anxious, right? Okay, that anxiety will build until you go feed yourself. Well, what happens if the systems are knocked way down and you're not eating and you're not feeding and you're not moving and you're not feeling good and all those other things are combined, pretty soon it doesn't matter anymore. You've lost your energy, right? Okay. Let's see. Do you happen to know how many millions of Americans have osteoporosis off the top of your head? What would y'all do if I said 25 million? Americans. That's just in America. Okay? Mostly Asians and Caucasian females, because it's 4 out of 5 females that it usually affects, which leads to increase in broken hips. Of course, for us that are PTs and OTs, we like having patients to treat, but we don't like the fact that people are hurt. Hunched backs. Have you noticed how many people get the little, is it a dowagers? Am I saying that right? Hump. And part of that is, if y'all remember our breathing exercise, okay, when I had y'all straighten up, you expanded. It's a lot easier to do this than it is to do this, okay? It causes 1.5 million fractures, and it costs us $10 billion annually in America for osteoporosis. That's pretty scary when you think about how high costs are going anyway. And the fact is that no one is immune. No one, okay? Younger females are beginning to have osteopenia, the thinning of the bone and having increased fractures. And I'm going to give you an example. I am 41 years old. I have fractured my left ankle twice. The first time I fractured it, I got it from my desk. That's it, and broke my ankle. The second time I fractured it was this last summer when I was not looking where I was going, and I stepped off of a curb about that much. Fractured it in the same location. And what they couldn't figure out is why was I refracturing, and found out that I have the thinning of the bones. I have an arthritis form, or a form of arthritis, which is called psoriatic arthritis. Anybody heard of it before? It's associated with psoriasis. Okay, it went undiagnosed for a very long period of time, but that's what it was. So how many years did I have psoriasis? And you can see some of the other joint deformities that are beginning for me, and I'm 41. I want to live till I'm 100. So I've got to take care of myself, and I exercise regularly. It's one of my things to bring myself back to health. There are a lot of risk factors, too, that go along with any type of disease or the osteoporosis, but lack of exercise, aerobic or otherwise, will lead to other problems. Y'all already know that. Y'all getting sleepy? No? Not at all? Okay. I want y'all to stand up again. Okay, now this time you're going to be spreading your feet apart just a little bit so that you can get a good firm base for yourself. And if you're wearing heels, you may want to keep in touch with the table or the desk. Okay, now what I want you to do is just rock back and forth. Okay, and when you feel like you kind of got the center where you'd like to stand, you can stop rocking. And you feel nice and centered. Okay? Everybody stopped rocking. Now close your eyes. I'll keep mine open. Cheater. Okay, do you feel yourself starting to rock again? Okay, swaying. All right, open your eyes. Okay, now this time 1 foot forward with your base still apart so you get good and balanced. And once again, just kind of rock back and forth till you feel you're comfortable. You may find yourself shifting to the back foot. It doesn't matter. Just make sure your base is good. And once you find the center, then just close your eyes. Okay. Now open your eyes. Now what did you notice about that?
Not quite so steady.
Not quite so steady. Did you feel like you were going to fall forward? Yeah? And some of you were going like this. I'm going to touch into yours when you do the balance part. Okay? Now, put your feet where you're comfortable. Okay. Are you standing in the most comfortable position? Feel pretty confident about where you're standing? Okay. Close your eyes. Are you breathing? Good. And open your eyes. That wasn't long enough, but you kind of get it. Did you move that time? You were moving? So you probably didn't have quite your place. Most of us will have found our place naturally. You wouldn't have to do the little exercises that I just did. And when you talk about balance in a little bit, most falls happen because they lose their balance. An individual loses their balance. Just like me, apparently when I fractured my leg, I just lost my balance. I don't know why. All right. Now, as you're standing with your eyes closed and you notice you started doing this, okay, a lot of times it brings on a fear for an older populace, and they'll begin to grab for things, okay, because they fear they're falling, or because they know that happens to them frequently from rising too quickly, they choose to stay seated. So I'm going to ask you to sit back down. Okay? A lot of times it's easier to remain seated. Now, how many mobility activities did we just finish doing? Quite a few. Did it hurt? No. Did you learn something about breathing? Some of y'all held your breath even while you were doing your standing activity. Y'all weren't breathing, you were holding everything. I watched you. The rest of you were breathing naturally, okay? What about your endurance? If I asked you to stand for a long period of time, how long do you guys in this room think you could stand? 4 hours? 6 hours? 1 hour? 2 hours? Okay. Most of the working force, unless they're seated in front of a computer or doing some kind, they stand for about 6 hours a day naturally. So about 6 hours would be your endurance. Okay. Now what about your own flexibility? If I were to say, how flexible are you? We kind of did this little demonstration a second ago. Those of you that came in a little bit late, we should have you stand. No, okay. You will normally go towards the side that is less flexible or least resistance. But what about trying to retrain yourself to get the other side going? Would y'all be willing to do that? Yeah? Okay. Flexibility, endurance, and mobility. Those are the 3 keys, in my opinion, that take away a person's independence. Okay? It subtracts from their years of fun. And what we want to try to do is to encourage people, if they can't do anything else, is to do some stretching. We want to, even in their beds, they can do things. Now I'm going to show y'all some real quick bed mobility exercises. I'm duplicating this for PTs and OTs, but I think for the rest of us, you can do activities in bed and you can convince even other people that they don't have to go to a gym to be able to do these things. And they're safe, and it will allow them, hopefully, to get more motivated and to increase their energy levels. I'll just give you a couple examples. Okay, now I know a couple of y'all are is that clear enough? Maybe you have a bad back now and you've been instructed on how to do back exercises. You may do some of these in bed or on the floor. But how many of you could bring your knee up to your chest right now? Good, good, all right. How about abducting your legs away, out, like this bottom picture? How many of y'all would be able to do that? Okay. What's important about being able to do those 2 activities? Your mobility, right? Okay. Also, if we were doing that first exercise where I said sit down, okay, you're thinking about you need a base to stand up, okay? So this just walks through a couple of the exercises. Y'all already kind of did some of the abdominals. Then we don't want to forget the rest of our body, and our neck down to our toes. And you may even want to add some of the things that you could do with just elastic or the, what are we calling that stuff? TheraBand. Okay, there's all different grades of TheraBand, and there are some commercial grade things that I don't think I could ever do, but you can also attach to your feet and do some resistive type of exercises. Okay? For people who are struggling, maybe they're already experiencing some limitations, there are also ways that you get up and out of bed. Now, my father had cardiac surgery, I guess it was 5 years ago, and of course they broke open the chest and did all that kind of thing, and they had, his pain didn't come from his chest. You know where it came from? It was his leg, and he still complains about the leg. Why is that? You suppose? I'm not a nurse. Pardon? That's where they took the arteries for it. So he took a lot of energy to just get out of the bed. Once he was mobile, he was okay, but just getting up and out of the bed. And there are right ways to get up and out. And even if you want to help strengthen people that are not actively having problems, but just want to increase their mobility. You guys saw a little bit ago about the balance. Balance is something else that you want to be working towards. Finding your center of gravity. As you fell when you were a little kid, did you think about falling when you were little? What happened when you fell? You just jumped right back up. How close were you to the ground? Right? There wasn't much risk in it, okay? So you didn't worry about it. But as we get older, our center of gravity sometimes fluctuates if we've gained weight or lost weight, or we're adjusting to problems with knees and hips. And so the fear of falling becomes much greater as people get older. They have a dependency then on canes and walkers, okay? One of the parts of the articles that I was showing you a little while ago is if you do weight training 2 times a week with enough resistance that you can only duplicate the movement 8 to 10 times, that you strengthen the muscles, you strengthen the bones, you increase your ability to function. Okay? That's not very much. 2 times a week weight training. 3 to 5 times a week is better. But it also improves your balance. Okay. Now, some people just can't stand exercise. They can do it from their chairs. In fact, there are probably a whole series of new videos that are out now, chair activities or chair exercises that people can do. And this is the one I was talking about. When y'all were popping up out of your chairs a second ago, y'all weren't doing any cheek walking or moving forward. You actually just popped up. But sometimes if you want to re-educate, you may want to start at being able to use the good proper posture forward and out. Teach other people how to do that when you see them pop out of their chairs wrong. Okay, I'm watching my time over there. Now, what else have y'all noticed about people who, as they get older, if they're getting the dowager hump or they're starting to have problems with the hips and knees, what do you notice about their gaits? It narrows. It gets shallower and shorter. And also, doesn't it almost look like it's a precautious walk? Yeah. And so, what does that do for your mobility? Does that make you flow easily through the gait, or does it slow? No. No, it decreases. In fact, it takes you twice as long to go the same distance it did maybe 10 years earlier. Okay? And so we want to try to look at what's going on with the gait. We want to try to encourage the people to, if they're strengthening their muscles, to be able to have a good follow-through with the walking. Even after PT, they've gone through therapy and they have the cane, they do better than before when they were fearful of falling. So those are some of the things that we look at over at the hospital. Now, one last thing I wanted to do. See if I can find it. Here we go. What do y'all think that is?
It's like an old man sitting.
Oh, it does look like an old man sitting. I didn't see that. That's great. Oh, that's cool. Well, when I made the copy, I didn't know it was going to come out so dark. But it's the moon and the stars, and then of course it's a mountaintop, and you can see it's kind of rough. As we grow older, we grow probably a little in our wisdom, but we really do need to take some time to think about where you are going, you yourself, in order to be a good provider of services. And sometimes you just need to slow down, take a few minutes, look at the stars or look at the moon, and design something that works for you. All of us in this room hopefully will grow old. All of us will experience life to the fullest, but disability or impairment may prevent you from living it as fully as you would like. So hopefully you understand the need to do more activity, to be mobile as you can, to increase your endurance, and hopefully to maintain your flexibility. Now, I'm going to ask you guys to do the flexibility test again. This time I want you to start with the opposite side that you would normally do. Just real quick. Okay? Did you gain anything? And relax. Okay. You may or may not see me again in the community, but if you do, and I remember you, and I usually do remember faces, I'm going to do like this to you and see if you can do it. Okay. Are there any questions? Yeah.
I'm just curious, when you said you had fractured your ankle twice, had you been exercising regularly ahead of those two fractures? So you were doing it?
Yeah, I like using